taking care of the newborn is quite challenging for new parents because they just don't know how to take care of the child. What are the do's, what are the don'ts in a newborn? So I'll be guiding these new parents how to go about it. So, first of all, the most important thing is we have to have a very proper hand hygiene because all the infections which are getting transmitted to the newborn are from the hands of the caregivers. So, we have to always remember that our hands should be properly clean, washed with soap and water, or at least we should use a hand sanitizer, whosoever is handling the baby. That is the first point. Second thing is we have to exclusively breastfeed the child. So breastfeeding is something which is very important, necessary, and which builds up the immunity, innate immunity, we call it as newborn immunity. So breastfeeding is a must and it should be exclusive breastfeeding, which also means that we have to give nothing other than breast milk to the baby. We also need to understand that newborn, since their skin is highly permeable, we need to cover the skin and their body parts in one layer of clothing other than what we are normally wearing. At least till 1 month of age, the head of the baby should be covered with a cap, hands should be covered with a mitten, and the foot should be covered with socks. That's what we need to understand. Also, a very important thing that the baby should be 24 hours should be with the mother and not with others. The point is, as long as baby is with the mother, mother gets more and more confident in handling the baby, and in the end, the health of the baby is good. So please understand those babies who are being reared, nurtured 24/7 with the mother, they are good, strong babies. We practice two important things in here. One is too early feeding. So let's say if we have fed the baby and baby has gone into a deep sleep, we will wake them up again after a gap of 2 hours. So that is needed even during the daytime, evening time, and in the night times also. So too early feeding, which makes at least 12 feeds 24 hours per day. So that is sufficient. Another practice that we tend to explain the parents is baby might get hungry before these 2 hours also. So please understand demand feeding is also necessary. So you have to practice demand feeding oblique too early feeding, whichever happens earlier. So if the baby is hungry, let's say we have fed the baby, baby has gone into sleep, he or she is again hungry after 20 minutes, refeed the baby. Baby has again gone into sleep. You have to feed the baby again when she or he starts to cry. So demand feeding, oblique, too early feeding, whatever happens earlier. But yes, do not let the baby sleep more than for 2 hours. Newborns, they'll always cry for anything and everything that happens to them. So please understand some very common conditions when baby will cry. 90% of the times baby will be hungry and that's why he or she is crying. So instinctively a mother should understand whenever the baby is crying there are 9 out of 10 times baby would be hungry. So always try to feed the baby whenever baby is crying. That is the first thing. There are some other reasons also baby might be crying, but they are very minor reasons. What are the common ones are? Baby might be feeling bloated. There might be some kind of a colicky which is going on, abdominal pain which is going on, or some gaseous distension, or that the nappy might be soiled. These are some other common reasons, but then they'll be contributing to not more than 8 to 10% when baby is crying. So the dictum is whenever the baby is crying, you have to feed the child unless and until baby is not accepting feeding. Burping is something which has been a controversial topic in neonatology. By and large, why burping problem happens in the baby, please understand. Whenever the baby is suckling and latching upon the breast, he or she tends to have some air also sucked in together with the breast milk. So that air causes some kind of a disturbance inside his tummy and feel uncomfortable. Also, what happens is whenever the milk goes inside the tummy, there is curdling of the milk that happens inside the tummy because there is an acidic medium inside the tummy. So there are some gases which are released while this phenomena happens, and then these gases also causes burping. So how to burp is important. We need to understand. Just take the baby onto your shoulder and then gently tap the back of the baby. The number of times people ask how much time they should be tapped is 20 to 30 times after each feeding. People also ask whether burping is necessary in the night hours also when mother is sleepy. So burping is not necessary while mother is sleeping. If the child feels uncomfortable 5 to 15 minutes after a feed, you might again take the baby in the similar way and just tap on their back, and baby will just release that gas and become comfortable. Newborns sleep for at least 16 to 18 hours in a day. So what we need to understand in here is the newborn will sleep and they will wake only to feed. So they'll feed, they'll see here and there, they'll see the parent, and then after feeding, they'll go off to sleep again. So please don't mind if the newborn is sleeping for 18 hours and even 19 hours. That is absolutely normal. Gradually, what happens is with time, as the baby grows, the sleep requirement tend to get decreased, and it is 12 to 16 hours at the age of 6 to 12 months, and so on and so forth. It tends to decrease with time. Diaper is something which is very important because newborn skin is very sensitive. The perianal skin, the diaper area is very sensitive. So we need to understand that beat any weather, try use those cotton nappies, which in Hindi we call it as langot. They are the best for the baby because they are cotton based, so they do not cause any rash. They are airy, they are ventilated, so air can go inside and out. So it usually doesn't cause rash. Once the nappy is in place, they should be changed after every 4 hours or whenever the diaper is soiled. If you are using a artificial diaper instead of a cotton nappy, we need to apply some kind of an emollient across the perianal area and the hip area so that there is kind of a barrier which is created between the skin and the diaper. So we can use any petroleum jelly or we can use coconut oil, any kind of a lubricant which covers the perianal area, hip region, and just then place the diaper and remove it every 4 to 5 hours or whenever it is soiled. So the recommendation is once the umbilical cord tends to fall off, we can start the bathing. That goes same with the massaging also. So massaging and bathing should be done once umbilical cord tends to fall off. This normally happens between 7th to 10th day of life when we can start bathing. The important point to note over here is we can use any gentle baby soap for bathing. Just remember ear, nose, and the oral cavity. No fluid should go inside while bathing. So just make baby lie down on those baby bathers. Put the straps onto them so that baby is secure. Place the baby in the bathroom and then gently give them a bath every day. Bathing is necessary like we do every day. It is necessary for baby also to be kept hygienic. So bath could be given every day. So important do's, few of them we have already discussed. Exclusive breastfeeding, only breast milk for 6 months of age. No top milk, no honey, nothing doing other than breast milk. Second is keeping the baby with the mother as much as possible. so that mother is confident in rearing the baby up. Third thing is, do not give your baby to servants, daima, or bais, ayabais for taking care, because their hygiene level and the hygiene level what we are maintaining could be significantly different. So hygiene is something very important. Hand hygiene of the caregivers is important. Do not apply any cosmetic other than soap, a massage oil, and moisturizing lotion to the baby. Another important thing is avoid exposure to other people, because the baby is very partially vaccinated at birth. So try avoid social contact as much as possible. Clean the room. So these are something very important. Also, one important thing I'll like to share is vitamin D supplementation has to be given to every newborn up to 1 year of age. That is something which will prevent rickets to happen in a infant.